One of the biggest developments in the global fight against COVID-19 is that the world's top virologist, Columbia University's Dr. Ian Lipkin, has come out to say that he has the virus as well. There's disbelief in the medical world that the man at the very front lines of the fight against COVID-19, the novel coronavirus, actually has the virus himself. And there's a very good reason for it. Just a few days ago, he went on to a television network in the United States where he coughed a little bit and then he admitted that he had the virus, and then he said he felt absolutely miserable, and he said that if he could get it, just about anyone can get it. And the numbers actually validate what Dr. Lipkin is saying, because remember the thousands of cases that have exploded across the United States, and the reason why people are finding it so hard to believe that Dr. Ian Lipkin would have this disease is because of the way he lives. This is a man who joined us on India Today just a few weeks ago, earlier this month in March, for a live interview where he explained in detail his lifestyle. Wearing gloves, in the New York subway, never greeting people with a handshake, being almost evangelical about not touching your face. He's in many ways almost a Taliban as far as a good conduct is concerned to keep the virus away. But this is a man who now has the virus himself, and that's why so many people are shocked. Many people took umbrage to the fact that Dr. Ian Lipkin had said that the only time he has ever fallen ill in his life is when he visited India on a trip to Puri in Odisha, and now he has the coronavirus.
Has been when I've been to India. And the last time was about 3 years ago when I went to Bhubaneswar, and I'm on my way to the airport, and we stop off at a monkey temple. And as I'm walking out of the exit, this monkey jumps on my back and sticks his fingers in my mouth. And everybody says, "Oh, that's such good luck." And I said, "No, I don't think so." And 24 hours later, I found out that indeed it was not good luck.
The interesting thing is Dr. Lipkin says he has a rough idea of where or how he might have contracted the virus, but he has not come on record to actually say how he got it or from whom. This has led to a lot of speculation. The Columbia University is seeing a shutdown. Obviously, there is a lot of contact mapping about where Dr. Lipkin could have picked up the virus from. He, of course, conducts research on a daily basis. In fact, before the pandemic became, so huge, he had actually gone into self-quarantine in New York City after he had visited China. He had gone to China. He used to be an advisor to China on the SARS epidemic as well. So he had gone to China earlier this year, and when he came back, he went into a self-quarantine. But now he has the virus, so contact mapping about where he could have picked this up from is something that's intriguing a lot of people, not least healthcare officials there in the United States. So to bring it all together now, where did he get the virus from? How did it spread? Could it have been during his research? Could it have been during his meetings? Did he leave New York City, anytime this month since he gave India Today that interview? All of these questions, I'm sure he must be providing these answers to healthcare officials and those who are treating him. But many questions remain unanswered even now. And I think what people are going to take away from the Ian Lipkin story is that this is a man who made worldwide headlines recently when people came to know that he was a consultant on Steven Soderbergh's film Contagion, which has become viral all over again because of the familiarity with what's happening now. But this is a person who understands viruses, who knows how to avoid viruses, a person who has advised the world governments on how to keep people safe and how to make sure populations don't get the virus. And he himself now has the virus, and that's one of the reasons why people are even more anxious than they already were.